with a dynamic spokesperson is for liberty of all kinds. But his specialty is in the area of health because he's a physician, currently living in Seattle, I guess, right? Spokane. And he was at Barry Ruick's program a couple months ago in Austin on healthcare. And so I hope that you'll give him a warm welcome in his presentation about health issues.
Do I have any Game of Thrones fans here today? All right. Well, my favorite scene in Game of Thrones is in season 1. And a character named Syrio Forel, who is a Braavosi sword master and Arya Stark's teacher, asks her, Arya, what do we say to the god of death? Not today. Every time the god of death shows up, my job is to tell him, not today. I can't make people immortal, but from time to time, I can make the god of death, and that's a metaphor, go away. Unfortunately, political ideologies, which I will refer to as cancerous or malignant later in this presentation, are getting in my way of doing that. And I'm sad to say that almost everyone in this room, myself included, is going to die prematurely, thanks to socialism, progressivism, collectivism, statism, altruism, whatever you want to call it. It's likely to kill all of us. So this is a pretty bold claim, but I want to make another equally bold claim. When I was a first-year medical student, I was offered the opportunity to enter a joint MD-MPH program. An MPH is a Master's in Public Health. At the time, I refused to do it on the basis that I believed public health to be a fake science. My argument was that health is a concept which can apply only to individuals, and the very idea of public health is somehow collectivist and some form of Orwellian newspeak. Later, I've engaged with people in the profession of public health, and I've slightly revised my opinion. Public health is, in fact, a science, and the best way to define it is the science of how to apply state violence to make people healthy. It's not a fake science, it's an immoral science. But, since my colleagues in medicine are big fans of public health, and they throw that term out there all around, I'm going to embrace it today. Capitalism is the most important public health policy in human history. So, I mentioned that I would call progressivism socialism, and we'll just add statism, altruism, whatever ism you want to call the idea that the state may use violence to create economic equality or other forms of equality. Whatever ism you want to put on that is an intellectual cancer, and that is the root cause of what is going to kill us. So these people start by saying equality is good. They never read Aristotle's Politics. They never thought that equality itself is very meaningless if you don't attach an adverb, if you don't say civic equality, moral equality, political equality. So they hear equality, they hear somebody has more than someone else, they feel that's bad, and not surprisingly, they begin endorsing very nonsensical policies. Constant attacks are leveled by these people against the most brilliant and the most productive members of our society. Bill Gates, Steve Jobs, Warren Buffett, the Koch brothers. But most disturbingly and most disgustingly are that these people praise the worst villains of our time. So this is Jeremy Corbyn, leader of the Labour Party in the United Kingdom. Thanks Hugo Chavez for showing that the poor matter and wealth can be shared. He made a massive contributions to Venezuela and a very wide world. Unfortunately, this guy still sits in the US Congress after Hugo Chavez died. Hugo Chavez was a leader that understood the needs of the poor. He was committed to empowering the powerless. Rest in peace, Mr. President. These are three very special people This gentleman in the middle, well known to all of us, makes himself available on various news programs and occasionally produces very bad documentaries, but he's actually a thought or an influencer of people who call themselves progressives in the United States. And look at the demons who he is hanging out with. And of course, he's tweeted his support for the Chavez regime in the past. This gentleman, again, is praising Venezuela specifically here, but also a number of other leftist regimes in South America. I would argue that he wants to turn us into a banana republic, but let's switch for a moment to something a little more upbeat. I don't think I have to work very hard to sell you guys in this room on this premise. The premise is we are wealthy to the extent that we are free. The freer an economy, the wealthier the people are. And this is a graph basically showing an economic freedom and GDP per capita. Correlation 0.63. It means there are other factors involved, but clearly economic freedom is one of the more important factors. So this chart demonstrates within regions the freest and the least free countries. So in every region of the world this relationship holds, and it's actually a lot more stark. And this is going to be the case because other factors besides freedom are going to be similar throughout regions, and freedom is going to differ a little more starkly. So it's further evidence, of course, that economic freedom leads to wealth. Good news. The world's becoming a freer place. So we've seen, over the last 10 years, economic freedom increase. We've seen global GDP increase. And the percentage of the global population in poverty has fallen dramatically. And so this is the point where I really start to get worked up and people start to think maybe that I'm a little crazy. Because I have in the past been in shouting matches over the concept of a minimum wage, or over economic regulations that seem academic or pedantic, banking regulations, know your customer rules, all kinds of regulations. And people say, Kyle, calm down, it's just a little bit of money. But my point here today is that it's not just a little bit of money, it's years of our lives that they are stealing from us. So, if I could estimate how much they have stolen from us in economic terms since the 1940s with regulation and redistribution, and unfortunately it's not going to show up that well, but if in 1949 we had stopped adding new economic regulation in the United States, our per capita GDP would be $330,000. So that's $277,000 per person per year in the United States that we don't have. Anyone want to guess whether we live longer with that extra money? Yeah. The slides are on both computers, and for some reason, yeah. Anyway. This is a complex chart, but it's worth understanding. So, on the, what is that, the x-axis, the y-axis, on the y-axis we have health, and by health I mean longevity, life expectancy in years, lower to higher. And over here we have per capita GDP, or income. And then we have all of the countries of the world. And if you study this, you will notice that over here on the poor side of the graph, nobody is doing better than about 64 years old. And that's actually an outlier. You can actually get down into the mid-60s. And over here on the right, where the United States, Europe, so on and so forth, the wealthy countries are, nobody's doing really, really badly. And there is a lot of variation in the middle part of the chart. So you have over here Vietnam, which is doing better than India, even though they're about the same. So this is where we want to talk academically that a lot of progressives argue that they want to improve quality of life. They want to take India and make it more like Vietnam. I would like to take India and make it more like the United States. That would be more life. So, one final graph, and then I'll stop boring you with numbers. This is how This is how the United States has done over time, since 1930 up until 2010. Our GDP has very closely tracked our increases in life expectancy. And this isn't a totally causal relationship, but I'll show in a moment how this happens. The point is, the richer you get, the longer you live. So we have to discuss why. And it starts when you start rising out of the crushing poverty that is the natural state of humanity, and you start escaping diseases of poverty. Diseases of poverty like malnutrition. Diseases of poverty like diarrheal illness that kills millions of people every year. And when you start rising out of that, and you get a little bit wealthier, you start to be able to control some infectious diseases. You get a sanitation system. You start to be able to crack down on mosquitoes, and you don't have malaria. You start to be able to afford vaccines, so you don't have things like polio outbreaks and measles outbreaks. And you start to get a little healthier, or wealthier, and you start to be able to afford some preventative healthcare services, whether that's a colonoscopy, a mammogram, or even things much simpler, such as penicillin in a child with a sore throat. That will prevent more heart disease than any cardiologist. Then, as you start to get even wealthier, you start to have a large economy of people who specialize. So, if not many people can afford medical services, the local doctor has to do everything. As the economy gets bigger, and as everybody starts to be able to afford medical services, you have a pediatrician and an internist, you have a cardiologist and a neurosurgeon, you have an ophthalmologist, and then you even have a retinologist who takes care of just part of the eye. And finally, you have research and development, and this is where we're focused right now in the United States in terms of where we're going to get our gains going forward. That is to say that a disease that today is deadly may be tomorrow survivable thanks to research and development. And this requires, especially at this point in the developed world, heavy expenditures of capital because we've taken care of all the low-hanging fruit. So I want to tell you a tale of two countries. We have over here Hugo Chavez and Fidel Castro, and I'm talking about Venezuela. Over here we have General Augusto Pinochet. All dictators, but the people of one country did really, really well, and the people of another country did very, very poorly. So this is the economic freedoms of the relative countries, starting back in 1975. Venezuela is blue. Venezuela has, and not just during the Chavez regime, it's been happening prior. Their economic freedom has been decreasing. But Chile has become much, much freer, even in the post-Pinochet era. So let's look at one very standard metric, infant mortality. When we started, Chile was poor. This is percent, by the way, 55%. More than 1 out of 2 children were dying before the age of 5.
No, it's not percent.
Oh, it's not.
No, it's number per thousand.
Thank you, Nick. Sorry.
Have good eyes.
Thank you. Sorry, I will get back to you on that statistic. But yeah, number per thousand, thank you. So, they quickly crossed. And I would suggest caution in interpreting the left side of this graph because I don't think the data is actually very good on the Venezuela side. I think you probably are seeing a larger spike. But the point is, they switched places. Life expectancy at birth switched places. So, a little bit over the 60s, and now we see Chile has pulled way ahead. So this is is a recently fired health minister in Venezuela, Antonieta Cabral. And in 2014, she published, in 2014 it was suspended, and the publication of an epidemiological bulletin by the government talking about measures of public health. She published it again. She revealed 65% increase in maternal deaths, 30% increase in infant mortality, the reemergence of diphtheria, which had previously been eradicated in the country. They are losing the low-hanging fruit now, and 250,000 cases of malaria. So she was fired after publication of that. But what does this all mean for a wealthy country? Because many of us from Europe or the United States here today don't have to contend with those particular health issues. Well, the people in this room, for us, our lifespan is likely to be impacted by research and development. It's likely to be impacted by what scientists come up with in the near-ish future to treat cancer, heart disease, Alzheimer's. And this is a chart talking about our most common causes of death, which I've just listed: cancer, heart disease, Alzheimer's, COPD, kidney disease. These are all the things that are likely to knock most of us off. So this is a report from UNESCO talking about research and development. It's not really a profound statement. What they are saying is that the wealthier a country is, the more they spend on research and development. That's a pretty dumb moment. Now, interestingly, they note that government expenditures for research and development have been going down, but overall expenditures for research and development have been going up. And that supports the libertarian line. But this is, now we're getting to the exciting part of the presentation. Because when I was a first-year medical student, one of my deans told me that hepatitis C is likely to be the next HIV epidemic. So many people have it, and over time, it kills them because it causes cirrhosis of the liver or liver cancer, and they die a pretty painful, nasty death. And at that point, there wasn't really anything that we could do to treat the vast majority of cases of hepatitis C. A couple of years ago, that changed. We can now cure with a daily pill for 90 days the majority, 95% of cases, with this drug called Harvoni. Now, I looked and looked to try to figure out how much it costs to develop Harvoni, and the makers are not forthcoming. They say their research and development budget is difficult to assign to a particular drug. But the point is that this is a recent example of a wealth-driven innovation in health. They were able to invest heavily to determine how to turn a disease that would kill hundreds of thousands, maybe millions of people over the next 10 years into something easily curable. There are a lot of issues with the pricing. That's not the point here, though. The point is people are living now who would otherwise die thanks to wealth creation. Even more exciting is a drug called Kalydeco. Cystic fibrosis is little by little becoming a disease that people like me have to learn about. I am a specialist in diseases of adults. Cystic fibrosis is not something that's really a major part of my training because in the past you didn't see many adults with cystic fibrosis. They died as children. That's changing. That's very good. So Kalydeco is a medication that affects the sorry for the scientific jargon, but it affects the chloride channel membrane and a protein folding there. It's a really specific way of counteracting specific mutations that cause cystic fibrosis. This doesn't work in everyone with cystic fibrosis. It works in about 3,300 people in the United States. It's a very niche drug. So this picture is posted by a young gentleman who was on Kalydeco, and he said, in the first photo, I was making fun of my own weight. He weighed 110 pounds, and he was on it for 2 years. Now he's up to 148 pounds. He's very happy. So this is changing. This is actually attacking the mechanism of the disease, and people are going to start doing really well. It's relatively new. The most exciting part about this is how it was funded. So the Cystic Fibrosis Foundation created what they call a venture philanthropy model. Governor Fortunio earlier today talked about how he thought there are areas of research and development we needed government for because in the early stages of a scientific endeavor, it's very difficult to connect spending to profit. The Cystic Fibrosis Foundation venture philanthropy model has addressed this. So they have a $425 million fund where they conduct basic research in an effort to determine potential mechanisms of action for drugs and get a project off the ground so they can get a pharmaceutical company interested and on board, thereby bringing about cures for the future. And for me, one of the most exciting things, where does the foundation get its funding? It's private, 100% voluntary. We are voluntarily, with a free market, marshaling large sums of money to tackle complex scientific problems and making people live longer. This is capitalism at work. And yes, there are a lot of problems in our market for research, development, and drugs. But people are, thanks to wealth, being deployed, living longer, and that's extremely, extremely exciting. And here's a picture of Star Wars, or Star Trek's Enterprise, I think that is. Because the future for us is in research and development. There's a new technology already being used called CRISPR-Cas9. It's a gene editing technology. I'm very excited because a company named BioViva has actually started its first N-of-1 one-person human trial for anti-aging therapies. They're targeting genes they think are probably involved in the aging process, and they're looking how they can alter those so that we can not age or reverse aging early stages. It's going to require a lot of money and a lot of dedication, and it's going to require them to find more freedom to conduct the research they need to make us live longer. It seems like every year something new comes out. Something where someone would die last year now lives this year. And if you trace it back, you find that money, large sums of it, from wealthy people, is what's at the heart. So you have very wealthy people investing heavily, and it ends up benefiting all of us. This is very exciting. Unfortunately, I see a threat on the horizon. I see political rhetoric in the United States, which is the main center of development of new therapeutics, discussing the redistribution of income. And their proposals are sometimes threatening and sometimes not, but it's part of a movement, and it's a growing movement. And when you see the students taking to the streets, and you see the philosophy behind their ideas, I think you come to know that they don't intend to stop with free college, and they don't intend to stop with free healthcare. And I think they are on the same path with the same goals as all the early supporters of Chavez and the Maduro regime. I think we really are fighting the same people at a different time in the development of their ideas. And they will put a stop to this. If they put a stop to the wealth creation engine of the United States, we all die early. So this is my favorite song, The Trees, from Rush. And the last paragraph. So the maples formed a union and demanded equal rights. The oaks are just too greedy, we'll make them give us light. Now there's no more oak oppression, for they passed a noble law. And the trees are all kept equal by hatchet, axe, and saw. Bernie Sanders, Elizabeth Warren, Nicolas Maduro, these people want to keep us equal, and they want to destroy the wealth creation engine of the Western world because of their malignant philosophy. And so I hope, ladies and gentlemen, that you will consider this an intellectual call to arms to do everything you can to fight for the philosophy of freedom and fight for an economic system of free market capitalism, because literally our lives depend on it. Thank you.
Do we have questions?
Could you show this slide with this lady who was fired?
Certainly.
I will take the picture. Thank you very much.
Anyone else? Other questions for our speaker?
So clear, understandable term, no question.
So much of the focus on healthcare has been on paying costs. Can you address some of the particulars about why medicine is so expensive? What has government done? in the last century that made it so expensive and monopolistic, I'd say, at the outset?
The government has broken the healthcare market into 1,000 pieces of monopolistic fiefdoms. It starts at the local level, where your hospital in 35 states in the United States has a monopoly over the services due to state certificate of need laws. Drug makers have monopolies on the sale of drugs in the United States, even when they don't hold a patent. Look at the case of Daraprim and colchicine as examples where they don't even need a patent to get a government-imposed monopoly. And I think most importantly is that we have severed the buyer mentality in healthcare. Patients do not make economic decisions about the care they receive. They do not say, is this worth it or isn't it? Because our healthcare plans are third-party payers. You get the care and someone else pays. It's created a toxic system where costs are just spiraling, and now even wealthy people can't afford it. It's stressing our system, and it's unsustainable. And because people are so stressed, they are more susceptible to socialist ideas. Bernie Sanders is going to give it to me for free. Well, I mean, he may give it to you for free, but then bureaucrats will decide who your doctor is, what care you're eligible for, and the cost will continue to skyrocket. So I hope that's a little overview of why it's so expensive. But everywhere you look in healthcare is a regulation here, a regulation there, and pigs feeding at the trough of cronyism in every single direction. And that includes my colleagues who are keeping other doctors out with burdensome licensing and regulations and training requirements. It just goes down the line. Drug companies, doctors, hospitals, medical device manufacturers, everyone's got their hand in the piggy bank trying to extract as much rent as they can.
Excellent presentation, thank you. It's sometimes argued, and I'm not saying this is my opinion, but it's an idea that's swirling out there, that socialized medicine or a single payer can actually enhance capitalism by removing the risk of leaving your existing job to go start an entrepreneurial endeavor because your healthcare is not tied to your employer. What are your thoughts on that?
Well, the reason healthcare is tied to employment today is because of our tax code. In World War II, or in the time of World War II, employers started offering healthcare as part of a plan in order to pay their employees more because there were wage controls, World War II associated wage controls. Subsequently, it was determined by our tax code that you will get a deduction. You will be able to pay with pre-tax dollars if it's an employer-provided plan. But if you want to go on your own, it's post-tax dollars. I would like to see healthcare completely divorced from employment. You're right that you're right that it's causing a huge drag on our labor market and on business. But I don't think the solution is to just go with a Soviet-style nationalization of an entire industry. I think the solution is to set the industry free.
A lot of people, when you explain to them how the free market would improve the healthcare system, simply do not believe you and think it's sort of pie in the sky. How would you know? It's just speculation that it would be so much better. So one way to deal with that is to point to examples of other countries that have a freer market and have better, lower costs and better results as a result of this. Can you point to such examples?
Well, I can point to an example within the United States, actually. Cosmetic surgery and laser eye surgery within the United States are cash-based, unregulated to a large extent, a very large extent, practices. In the last 20 years, in terms of real dollars after inflation, eye surgery and cosmetic surgery has gotten cheaper while healthcare has nearly doubled in cost, overall healthcare. So right there, you see, even in the United States, under the exact conditions we're living in, some services are getting cheaper, the ones that are subject to the market I am advocating. Singapore is an example that I can kind of point to. The government is heavily involved there, but they have done a very good job of controlling costs. And the reason they've done a good job of controlling costs is because nothing, even on their government plans, is free. Even the poorest people in Singapore have to make a copay. And that means that they have some element of that choice, of people deciding if it's really necessary based on economic calculations. And that's why I think Singapore is not having the kind of financial strain of healthcare that other places are. But again, I'm not going to point to them as some beacon of a wonderful system, because there's heavy government involvement as well.
By the way, Kenley has an announcement about a plan for group photo at the conclusion of our event. I don't want you to disappear after the last talk. I want you to be available for that group photo.